8:10 a.m. Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with Makati Med as we discuss the latest health and medical topics with doctors from Makati Med. For a healthier and uplifting lifestyle, tune into Healthline with Makati Med on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with Makati Med, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from Makati Med interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with Makati Med. I'm your host, Nicole Jacinto. Today, we're with Dr. 𝗂𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 your last names are like Langit de la Cruz, like Heaven of the Cross.
Yes.
Yeah.
Heaven.
Heaven of the
Yeah.
Cross. Yeah. Okay, so welcome to the show, Doctor. This is the first time that we have you on the show, and it's a great topic today, especially for
Yes.
women out there, and also the men who they may learn and understand. And our topic today is endometriosis, and of course,
Yes.
Dr. Patricia Langit de la Cruz is an OBGYN. She is, yeah, she's an OBGYN. Do I have to say the whole thing? Obstetrician gynecologist
Gynecology.
specialist.
OBGYN is okay.
Yeah, or OB-GYN as we call it. So, doctor, okay. Topic is endometriosis. Can you tell us what endometriosis is?
So, endometriosis is a chronic gynecologic condition that happens when the tissue similar to the lining of the uterus, which is the endometrium, grows outside of the uterus. And this tissue can implant in the ovaries, the fallopian tube, bowel, bladder, and other pelvic structures. And then this can lead to inflammation, scarring of tissue, pain, and sometimes infertility.
Okay, so that's great, doctor. Because I was gonna ask you, like, does it affect other parts of a female's reproductive system, like the fallopian tubes, the ovaries, and all of that? So actually, it does. I mean, it
Yeah, it does.
actually can grow outside. Okay, so that's what
Yeah.
it is. I'm so glad. I just learned something, and okay, so there are many women, and like when I was growing up, just when it's a girl talk and everything, you probably have endometriosis, but nobody really gets checked, and we hardly talk about it. So I'm very happy to have you today. Okay, so doctor, what how common is endometriosis in women of reproductive age, and what exactly do you consider or is officially considered reproductive age? Because you said it can lead to infertility and all that. And what is reproductive age? Because like nowadays, and even before, you could get pregnant, even at an older age. So what is it
Yeah.
exactly?
Reproductive age is between the ages 15 to 49 years old.
Okay, all right.
So that's considered reproductive age.
Okay. So doctor, if and of course we know that as females in our ovaries, we have a certain number of of eggs only
Yeah.
that are released every month. So
Yes.
this is, this topic, endometriosis, is very much related to getting menstruation, but I will
Yeah.
circle back to that in a bit.
So, yeah.
Okay, so doctor, um, when actually, um when we were yeah, when I was younger, and like when I hear girl talk, um ha, ki- about endometriosis, or reproductive age, how is it related? Like, well, actually, what are the signs and symptoms? I'm sure we'll get to the menstrual cycle at some point.
Okay. So first, with your question a while ago, how common is it in the Philippines?
Yes,
Yeah,
yeah.
I haven't answered that yet. So in the Philippines, endometriosis affects approximately 10% of women of reproductive age, and this means that around 1 in 10 women in this age group may be diagnosed with endometriosis. But some studies suggest that it might be slightly higher, because for so many women, it can take years for a diagnosis. And usually it's more common to be diagnosed at ages 20 to 40, but
Mhm.
it can affect women of any age within their reproductive years. It could start as early as your first period and could last until menopause.
Thank you, doctor. And
Yeah.
maybe you were saying that the number could be slightly higher because women don't get diagnosed in the Philippines.
Yeah.
Yeah, I mean, that's also something that I'm glad this show is, this show is going to be a platform for information, and maybe getting women to go out there, and we can talk a bit more about that later, to get checked. And also,
Yeah.
it's just something that, especially like in other areas, if you're not in let's say the not in urban areas, but in the provincial areas, you don't really get the whole checkup, like, oh, okay, I'm fine. And then
Yeah.
maybe there may be signs and symptoms, but we just accept it as it's part of being a woman. Or
Yes.
okay, so what are the signs and symptoms, doctor? How does it manifest?
So the most common symptoms of endometriosis include dysmenorrhea, or painful periods, chronic pelvic pain. There could also be pain during or after sexual intercourse, pain with bowel movements or urination. Some women may also experience heavy or irregular menstrual bleeding, constipation, nausea, bloating, and fatigue.
And is this just during the period, or like any time? Like for
Uh,
example, the pelvic pain, the diarrhea, and all of that, or is it just mostly during the when women have their menstrual cycle?
Mostly it's of a cyclic pain, but they could experience it um, a days before
Mm-hmm.
the menstrual cycle.
Yeah. And then also, doctor, you said sometimes it manifests in women having irregular periods. And I notice these days a lot of people, females in their 30s in the Philippines, like people that I know, they either have PCOS or they have irregular periods. So I mean, I don't really know what that's about, and I'm sure, you know, that will have to do with scientific research and all of that, and surveys. And um but when it comes to the menstrual cycle, they can also have pelvic. Is it just around that time, or like it can be really bad? Is it only painful during someone's period, or can they have it at different times, like
Uh,
when they're
yeah,
already. Mhm.
they can experience it before the menstrual cycle, before the menstrual period, during, and even after. They could experience the pain.
Okay. So
Yeah.
sometimes we just chalk that up, as women, we just chalk that up to, oh, it's part of it, no? I mean,
Yeah.
yeah, it's part of it. I have my period, it hurts. Is it, is,
is it always painful? Are painful periods and cramps and dysmenorrhea always a sign of endometriosis? Is that the biggest? Is that the biggest tell that you may have it?
No, painful menstruation is not always a sign of endometriosis. Although endometriosis can cause severe pain during menstruation, it's not the only cause of painful periods. Aside from endometriosis, painful menstruation can also be caused by other conditions like adenomyosis,
Mm-hmm.
uterine fibroids or the myomas,
Mm-hmm.
pelvic inflammatory disease, or it may just simply be due to normal menstrual cramps.
Yes, yes, we do get that.
Yeah.
So, I mean, it it kind the symptoms kind of overlap with other illnesses, but so we'll talk about like how you actually we'll circle back to how you actually diagnose endometriosis a little bit later in the conversation.
Yes.
Doctor, can you debunk a myth? Um, because I remember I know a lot of women who say, and I remember like the older women used to say, "Oh, if you have a painful period, you probably have endometriosis." Without any diagnosis, and they would say, "Once you give birth, that will go away." Is that true or false?
Um, the painful periods usually go away when you get pregnant because you don't menstruate,
Mm-hmm.
and if you don't menstruate, the endometrial tissues will be atrophied. So it's it's some kind of
Somewhere,
go away during pregnancy.
but only during pregnancy, because they would say, "Oh, once you give birth, that's it." So that's not really, if it's endometriosis. Even if you get when you're pregnant, okay, you have some relief from endometriosis, but after you give birth and you get your period again, then you'll still have endometriosis if you have it.
Usually, after menopause, you shouldn't be experiencing endometriosis because you don't have the hormones
Mm-hmm.
that causes the endometriosis. And also, our treatments usually works that way that we don't menstruate so that there is slowdown of the growth of the endometriosis tissue.
Doctor, if it's so related to the menstrual period, I mean, it's, it really is related to menstruation. Is it is it because there's blood forming like in the lining inside? Is it or the hormones? You said, is it the hormones when you're menstruating? Is that what causes it?
Actually, the exact cause of endometriosis is unknown, but there are several theories that exist that attempt to explain this disease. And the most commonly supported theory is the retrograde menstruation, where menstrual blood containing endometrial cells flows back through the fallopian tube and into the pelvic cavities. These cells then can attach to organs and tissues, and they could bleed during the subsequent menstrual cycle. So
And
that's the most common.
that's how it kind of gets around also to the how the endometrial cells get around to the other parts of of a female's reproductive system.
There are other theories that explains that. One is the coelomic metaplasia,
Mhm.
wherein for the coelomic metaplasia, the peritoneal cells
Mhm.
transform into endometrial-like cells, and this explains endometriosis in the bowels and other pelvic organs.
I see. What are peritoneal cells? Just a quick overview, and
Yeah,
how
this
they transform.
yeah, these are cells in the pelvic region. So we call them peritoneal cells,
Mhm.
and they transform through metaplasia. So they just like, for example, I'm a peritoneal cell, and
Okay.
then I would want to transform into an endometrial cells. So I would transform into endometrial cells, and because I'm an endometrial cells, I will respond to hormones
Mm-hmm.
cyclically, just like those in the endometrial lining of the uterus.
Okay,
So
great.
that's,
Great,
yeah.
doctor. But if they want to transform, like, is it genetic? I mean, is it something like they transform because they just. I mean, how can they just transform that way? Is it genetic or hormonal?
Actually, there's also this genetic predisposition
Mhm.
because we can see that it tends to run in the families,
Mhm.
and we can also see that it's the risk is higher for those with first degree relatives who have endometriosis. But then for the coelomic metaplasia, they just transform. So cells, one cell transform into another.
Mhm. Okay.
Yeah.
So that can happen. It's not necessarily like a gene that doesn't, that it's not necessarily a gene that tells it to transform because there's something going on there. They can just transform through
Yes.
the process that you call metaplasia. Okay, thank
Yeah.
you, doctor.
Totally.
It's very, very enlightening and informative. But also there's you see that you were saying that it can also be genetic in the sense that you often see it in, like, if a what can tell us exactly what a first degree relative is it a sister, a mother?
Yeah. The sister, mother,
Okay.
those are considered first degree relatives.
Okay, so and it usually runs in the family, like one will have it, the other will also have it.
Yeah.
Then, often, like, when a bunch of females live together, eh, you get your period all at the same time or one after the other. Um, so everyone's in pain at the same time or one after the other. So yeah, okay. So I mean, these are things that women understand very much. So I mean, it affects us. So I'm very glad we're talking about it. And okay, so doctor, when should someone seek help for if they think they may have endometriosis? When should they see a specialist like yourself or an OBGYN?
So they should seek medical help if the menstrual pain is significantly worse than usual, or if it disrupts daily activities,
Mhm.
or if the pain doesn't respond to pain relievers. And also, when pain is accompanied by other symptoms like pain during intercourse, pain with bowel movement, or if there are significant changes in the pattern or duration of their menstrual bleeding, such as prolonged periods or unusually heavy bleeding.
Okay. Doctor, when you say intercourse, just to clarify, is it intercourse between, we have to define these things for the audience. Is it, when you say intercourse, do you mean like a penis and a vagina, or is it like
Yes,
fingers and a vagina?
yeah, that
Both?
kind of intercourse.
Yeah. So anything basically being inserted and some effort uh,
Yeah.
there. Okay. All right. Thank you, doctor. Um, okay, doctor. So when how do you okay, so let's say somebody goes to you and they say, I think I have endometriosis or I'm in pain. I have these symptoms. It's too much. There are days when I've seen people and I've had those days too when you just you can't get up. Like in the past,
Mm.
you can't get up. It affects your daily life. I've seen women like they have to take the day off. I mean, um, because they're just in bed, they're curled up, and it's a physical pain. You cannot really do anything about it. At least in these days, we have work from home. But before, um, people would criticize them. They're out of the office. They're just using it as an excuse. Like, I think a lot of women or females have experienced that, or in school. Sometimes, like in high school, like somebody will be absent, and a girl will be absent, and then the teacher will be like, "Meh, jeh, jeh, jeh," but actually, the kid was really in pain. Um,
Yes.
when they go to you, how do you diagnose endometritis? endometriosis exactly?
Endometriosis. So endometriosis is typically diagnosed through a combination of symptom assessment through detailed history, then we do pelvic exam, then we do imaging, and ultimately surgical confirmation via laparoscopy.
Okay, so you do the clinical exam, which is okay. So a part of it is, of course, you interview the
Yeah.
patient and you get their history, so you can tell already, and it's like you're detectives, right? Doctors can
Yes.
detectives, like, okay, so this happens, that happens, and when you get your period, and these are your symptoms, and then there's also the procedure, or you do imaging. You said, what kind of imaging
Yeah.
do you do?
We usually do transvaginal ultrasound or MRI to check for the presence of endometriosis, especially if there are ovarian endometriomas or deep infiltrating endometriosis. But it is only through direct visualization during laparoscopy, often with biopsy, that we can definitely diagnose endometriosis.
The pelvic exam, doctor, can you just elaborate on it, or tell the audience what it is? Is it you checking the vaginal area, like yourself first?
Yeah, we do check the vaginal and the rectovaginal, right? We do check for the rectovaginal area for any nodulations. So,
All right.
yeah,
Okay, so is that like a pap smear kind of, or similar to that?
it's similar to that. The position is the same, and then we usually do the rectal exam
Okay.
also with the vaginal examination.
Okay. All right. So, okay. So that's that, you do that, and then you do the imaging through the
Trans-
transvaginal, and then you said the laparoscopy. Can you kind of describe that procedure to us? And what exactly you do? I guess you get a sample or something.
So for the laparoscopy, it's a minimally invasive procedure which involves making small incision in the abdomen. Then we insert a camera, which is the laparoscope, and
Mm-hmm.
other surgical instrument, and then we excise endometrial tissues. We cut them away, or we ablate them, or the endometrial tissues are destroyed using heat or other methods.
When you
That's
say when you
laparoscopy.
say oblate, doctor, you mean like burn them out?
Yeah,
Okay.
yeah, you destroy it using heat.
Okay. And then, doctor, I mean, as a woman, and I'm sure you've encountered this, if when you say you cut into the abdomen, small incision, uh, it's like, okay, first you put the patient under general anesthesia, or just.
Yeah,
Mhm.
it's definitely under anesthesia.
Okay, you sedate them so they're asleep. And
Yes.
it is minimally invasive, but doctor, I mean, woman to woman, a lot of women will say, "I, it's okay. I'd rather have them cut into my abdomen than." It's like we have in our culture, we have this fear, or it's sort of taboo, that I'd rather have that than have them put an instrument inside my vagina. Have you encountered that with your patients, like the fear and the maybe being shy and all of that?
Actually, it's more of they're afraid of the surgical procedure having a larger scar. So most patients usually would opt for laparoscopy because of the smaller scars.
Yes.
Yeah, and
Okay.
the recovery time and the um, blood loss is also minimal.
Yes.
So yeah.
So, doctor, when you do a laparoscopy on to really confirm that that a female has endometriosis, how long does it take? Is it an outpatient procedure, or do you keep them in the hospital for a couple of days?
Usually they stay for a couple of days.
just to recover and all of that.
Yes.
Yeah.
Yes.
Okay. And then, of course, so you want to check because you got for infection or anything like that. I'm sure you check
Yes.
them out and see if they're okay. Okay.
Yes.
There's also the vanity that comes in. No? Like, I don't want a big scar. You know. Then
Yeah.
we all know that. I mean, um, from girl talk, I don't think anyone wants a scar.
Yeah.
That's very visible. And so okay, so that's very interesting to know that that comes into the picture when patients come to you to get properly diagnosed for endometriosis. Okay, so doctor, we you did mention earlier that we don't know the what causes endometriosis, but there are several theories. What
Yes.
what do you mentioned the theories already, but what do you think are the most, or what are the most popular theories? The most backed up by scientific data, or what the medical community believes.
The most yeah. The most commonly supported is the retrograde menstruation, where the blood flows backward
Mhm.
from the fallopian tube into the pelvic cavity.
Okay. Yeah.
Yeah.
All right. Okay. Yeah. Because okay. So yeah. The okay. So that one. That's great, doctor. That you can at least give us like the most supported theory of endometriosis. And then, doctor, you did mention earlier that endometriosis can affect fertility. Can you just expound on that a little bit? Why how can it affect a woman's fertility or make it difficult for her to get pregnant, and and have a and carry a baby in her womb, and all of that?
It affects the fertility significantly because endometriosis causes anatomical distortion of the pelvic organs like the ovaries and fallopian tubes, potentially blocking them and making it difficult for the egg and the sperm to meet. It also could trigger chronic inflammation, which impairs the ovulation, fertilization, and implantation. And commonly, they also produces ovarian endometriomas,
Uh-huh.
cyst in the ovary, and this may reduce the ovarian reserve.
Okay. So
Yeah,
okay. So guys, in case you're not as familiar with the female reproductive system as we women are. We have ovaries, they release eggs, and then
yeah,
it passes through the fallopian tube, and then when you have intercourse, the the sperm, well, the semen that contains sperm meets with the egg, and there's just like
yeah,
one that can fertilize the egg, but
yeah.
like go ahead, doctor.
Actually, I
It
have
is
I'm not sure
apple.
if you can
Yeah,
see it.
I can see it. That's
Yeah,
great. The ovaries
yeah.
are there.
So
Yeah.
these are the ovaries. Sorry. So this is the uterus.
Mm-hmm.
Sorry, it has the condition. Then we have two ovaries here, and then this is the fallopian tube.
Mm-hmm. Yes.
So the lining is here.
Mm-hmm.
So
Yes. And
yeah,
doctor, like as we can see it, for those who can't hear, just imagine, who can't see and who are listening, because we have listeners who can't actually see. Um, this it's two ovaries beside each other, and then there are two
yeah,
attaching
yeah.
them.
These are the ovaries.
Yes. Those are
Yeah,
the ovaries. So of course,
yeah.
if it causes blockage, then doctor, as I can see it now.
Usually here
Yeah.
in
So
the fallopian tube. Usually it blocks the fallopian tube if there are adhesions due to endometriosis.
mm-hmm,
So it makes it difficult for the sperm
mm-hmm,
and the eggs from the ovary to meet here. Usually, this is the meeting place.
okay. All right,
Yeah.
doctor. So does it, if let's say there's some kind of blockage, I don't know, I'm just thinking, if there's some kind of blockage, but and yet the egg, the ovum, tama ba? Please correct me if I'm wrong.
Yeah.
Okay, and the sperm can meet. can this be a cause of they still meet but then they're blocked there? Can this be a cause of ectopic pregnancy? I'm just
Yeah.
Mm.
Mm.
Okay, so it can cause that. Oh, also, so there's a
Yeah.
danger to it as well.
It's
'Cause-
it's it's a it's the most common cause of ectopic pregnancy.
oh, okay. And
For it's a common cause of ectopic pregnancy if there is blockage and then the egg and the sperm meet here in the fallopian tube. So, and the pregnancy, if it doesn't implant in the
uterus in the womb.
uterus, yeah, the pregnancy would grow here. And as you can see, it's a small area. So if it grows in this area, it could rupture.
Mm-hmm. And of
Yeah,
course,
that's ectopic.
ectopic pregnancy is a different topic,
Yeah.
and I hope you come back and talk to us about it because you're such a
Okay.
you're I mean it's so nice to talk to you, and you're such a great guest, and you're so informative. But yeah, no, I just thought about that. Oh, it's blocked because some people have ectopic pregnancies, and then they'll have such a hard time conceiving, and so that could be a cause, okay, of ectopic pregnancy. Or as you said, it's the most common cause of not.
It's one, actually it's one of the cause. It's not the most
It's
common.
not the
Yeah.
most common.
It's a common, just a common one of the cause.
One of the causes. Okay, thank you,
Yeah.
doctor. Okay, so that's how it can affect your fertility. Now, doctor, what are the treatment options for women who have endometriosis? There are, I mean, for in terms of pain relief and maybe long term management, and then perhaps later we can circle back to, is there a cure, and is there surgery? But what about pain relief and management? What are the options, and how do you treat women who have endometriosis?
So for endometriosis, the treatment depends on the symptom severity and fertility goals. So options include medical therapy with pain relievers and the hormonal treatments like combined oral contraceptives, progestins, GnRH agonists, antagonists. While the long-term management may involve hormonal medications which are used to suppress menstruation,
Mhm.
um, and slow down the growth of endometriosis tissues, or by surgery via laparoscopy to excise and ablate the lesion, especially for those with severe pain and infertility. And then we have hysterectomy, which is considered as a last resort for severe cases and those who want and those for severe cases and those who have completed their family size. We could also offer assisted reproductive technologies such as IVF for patients with infertility.
Yeah, that's great, doctor. Okay, so you can manage the pain, you can help the patient manage the pain, and it depends on the level of the pain and what they're going through. And if they have issues with fertility,
Yeah.
and they're having a difficult time conceiving, you can use IVF to make sure that they can, if they want to have children and carry it in their womb, you can
Yes.
do that. And but also you said you prescribe medicine and hormones, and um I know of a few people that I brought to the doctor. Not you, of course, but I'm the kind that brings everyone to the doctor. That's why I have this show. So,
Okay.
I'm that type of person. Like when they get a diagnosis, I don't know if they said they had endometriosis, but they don't want to take the pill. They don't
Yeah.
want they don't want to take the pill or the hormones because they think that they will not get pregnant. Can you sort of tell us why that is not true, or how come? Sort of like explain to people out there, because they're so afraid of taking the pill or the hormones or anything like that. Some even in our society think it's shameful to take it, to take hormones or pills that the doctor prescribes, even if they have conditions, maybe not even endometriosis, but something else, because it's sort of taboo some in in very many areas of our society and culturally, like, oh, you're taking the pill, why, you know.
Yeah, yeah. So, when taking the pill, it's not only because we're taking it for contraception, but it's true that when we treat endometriosis, we won't get pregnant because the aim for the treatment of endometriosis is to suppress the menstruation so that those ectopic endometrial tissues um, won't be bleeding because they react to hormones cyclically. And then another aim is to slow down the growth of endometriosis through these hormonal treatments.
Through the treatments and the medication, the kind of therapies you give. I'm so glad you said,
Yeah.
doctor, because sometimes it will just be someone will not explain it, and then they'll be ashamed. I mean, I've seen many examples of people in who or Filipinas who don't want to, they don't want to take it because they're ashamed,
Yeah.
or it's because it might mean something else. And it's still something that we deal with in our society. There's a
Yeah.
psychosocial component to it. Do you find that you have met people or patients like that in your practice?
Yes, a lot of patients are hesitant to use pills, but then I explain to them that this is for their treatment. Yeah.
Yeah. And maybe you have a 15 or 16-year old who has it and it's really bad, or someone in 18, and then they're like, maybe even their parents will be like, what? You're gonna put my daughter on the pill? They have all of these psychosocial issues going on. And also in the provinces, it's very, I will not take the pill, because it means something else. So yeah. Okay.
Yes, I get a lot of that, and I just explain it to the parents, or I let them explain it. So
Yeah. And I'm sure with the way you explain, they understand it completely. And that's one way of treating patients. So you're being a good doctor by explaining everything and explaining things, because it's just so easy to walk away and misunderstand if things are not explained properly. So thank you for that, doctor. Thank you for your service to
welcome.
the women whom you treat. So, doctor, when is surgery? You mentioned um there is, you can do different types of surgery, and then you did mention even a hysterectomy, no, for
Yeah.
those who don't want to have children, or I mean, maybe they don't want, as you said, their family's complete, like maybe they have 3 kids, and
Yeah.
when do you recommend um surgery for endometriosis? At what point?
We generally recommend surgery for endometriosis when medical treatments like pain medication, hormone therapy are not effective, or when there are specific complications like endometriomas or involvement of other organs. It's also considered for women with endometriosis who are experiencing infertility, or when the condition is causing severe pain and functional impairment.
Yeah. I mean, if you cannot function anymore,
Yes.
I mean, and you have to go through this every month, and it's something, you can't manage the pain anymore, then you can recommend a hysterectomy. And when you say hysterectomy, doctor, do you take everything out? Like, not just
Um,
uterus?
The hysterectomy is when we remove the uterus,
Mm-hmm.
and sometimes we also remove the ovaries.
Mm-hmm. Okay.
Yeah.
If a patient is younger, do you sometimes leave the ovaries for purposes of hormones? Or, I mean, is there a point where you decide na this patient only the uterus, this patient also the ovaries. Are there situations like that? I know it's
For
in,
younger,
yeah, go ahead.
okay, yeah. For younger patients, we can opt for cystectomy, wherein we only remove the cyst.
Mm-hmm.
Yeah. Or if there's no normal tissues, normal ovarian tissue, we remove the whole ovaries, but then because there are two ovaries, so we can opt to save the other one.
And doctor, this you save the other one because yeah, is it to help with the female's hormones also, especially when they're
Yes.
okay? Because if go ahead, doctor.
Yes, because we don't want to make to render them menopause at an early age.
Yes. I mean, because if you take out the ovaries, yeah, okay, menopause, and then as at an early age. And is it dangerous to get menopause at an early age? Like when you remove when you have to remove everything, including the ovaries. Do you? I mean, what does it entail? Do you give therapy after, because to, let's say, to younger women?
It's dangerous because they won't have the protection that the hormone gives, like cardiovascular, especially for bone health.
Okay.
They'll be more prone to osteoporosis
Oh my
at
God.
an early age, at an earlier age.
This is making so much sense right now for someone that I know personally. I mean, her osteoporosis, maybe that affected it. Okay, maybe maybe that affected because she got it. What do you consider an early age for osteoporosis?
For osteoporosis, sorry, but osteoporosis usually happens when you're old, like more than 50.
Mm-hmm.
Yeah, but then, if you get early menopause, like when you're less than 40,
Mm-hmm.
so that's considered early menopause when it's less than 40. So if you surgically remove the ovaries when you're young, less than 40, you have to give hormonal treatment.
Okay, that's okay.
Yeah.
Doctor. And then, doctor, earlier, just to go back to it, you were talking about pain management for endometriosis. What kind of painkillers do you give? May I ask you?
Yeah, we usually give we just give the we could give over the counter medications like the non-steroidal inflammatory non-steroidal
NSAIDs, the non.
anti-inflammatory, yeah, the NSAIDs, non-steroidal anti-inflammatory
And
drugs.
if someone is, let's say, allergic to NSAIDs, do you have other options? I mean, well, probably medicines that aren't as strong, but it's over the counter medicines that take away pain, basically.
Yeah, we could also give other medications, pain. Yeah,
Doctor, there's this popular medicine. I think the generic name is Hycosine.
hyoscine.
Hyoscine. Okay,
Yeah,
there I go. Cannot be a pharmacist. I mean, with my pronunciation, but everything. So, a lot of people take that. No.
yeah. It's
Um,
the yeah.
is that okay? Are they correct in taking that?
They could take that, but it's better if you consult your doctor first before taking it. You might be taking the wrong medication. So,
Okay. For the pain that you're experiencing.
yeah.
Hyoscine do, does it stop cramping, or I mean, what is this? It's very popular. Like everyone, kind of takes it, and then
Yeah,
yeah, go ahead,
it
doc.
stops the cramping. Also, it's
Mhm.
anti-inflammatory.
Okay.
Yeah.
And sometimes, no, we have the it's marketing, but it's also like medication. Like they have a, I don't know. A lot of people call it Venus, or they'll
Ah,
do it. The
the Buscopan Venus.
Ganyan.
Yeah, that one is hyoscine with paracetamol.
So there's a component there that takes away pain. Yeah.
Yes.
Okay. All right. And then, doctor, you mentioned NSAIDs, no? Of course, they're stronger, but should a patient, of course, consult? Let's say you have a patient who they're managing their pain. And you know how when it's over the counter, some patients will start self-medicating. I need more of it. But NSAIDs can be also, it can hurt your stomach, right? I mean,
Yeah.
okay. So it's important for the patient to always check with you. I mean, not every day, but to check with you what exactly the the concoction or the therapy is.
Yeah. Also, the symptoms of endometriosis could also look like other conditions. So, yeah, you can be taking the wrong medication
Yeah.
for another
Yeah.
condition.
You might think it's your back, no? Or your I mean the lower back or your pelvic area. You might think it's your hip or something like that. And then you're just taking a medicine that won't exactly address what's really causing the pain. Okay, so
Yes.
thank you for that, doctor. Like, so folks, check with with Dr. De La Cruz and other OBGYNs, also other OB-GYNs.
Yes.
Because if you just self-medicate, I'll take this, I'll take that, just to, take away the pain. Or maybe you don't have endometriosis and you have something else, but you just
Yes.
you do, okay. So doctor, are there any lifestyle changes or dietary changes that women can make to help with endometriosis, or to maybe pacify it, or to manage the pain?
So they could have lifestyle modifications and diet changes. They could also have regular exercise, especially like yoga and Pilates, they could have stress management, acupuncture, physical therapy, or they could get mental health support. These complementary therapies can be valuable addition to medical and surgical treatments, but their effectiveness can vary.
Thanks, doctor. I mean, you mentioned a whole, like, I mean, acupuncture. I've tried
Yeah.
it, for a different condition, but it works. I mean, and then you're not, putting any. It's just, it doesn't hurt, folks. It doesn't hurt. People get afraid of
Yeah.
needles. And then you mentioned exercises, like especially yoga and Pilates. Why yoga and Pilates?
These are just some of
Example.
the exercises example, but they could do other exercises.
Okay. And then, do you recommend? Okay, so here are some things that we've heard also growing up, in the girl talk about having your period and pain. Can you run if that's your exercise, if you have endometriosis? Because some people
Yes,
say,
and
you can. Okay.
yeah, any type of exercise is okay.
And then another thing that I've heard is, oh, when you have your period pain, you should exercise at that time because it will help. Is that true or false,
Maybe
or somewhere in the middle?
maybe it could help. Yeah, it could help.
It can help. It actually
Yeah,
can help. Okay, so
yeah.
telling this girl talk that you've been having for 50 years or more. I mean, people, maybe from experience of being women, you should exercise. But if you're really, really baldado, doctor, then maybe exercise before or after. I mean, pag baldado ka talaga, medyo hindi, di ba?
Well, they could have passive exercises, which physical therapists could do, or their relatives. So
Yes.
yeah.
And doctor, physical therapy, okay, that's very interesting. That's a very interesting pain management therapy for those with endometriosis. I mean, nobody would really think that immediately. What kind of physical therapy is it? Is it stretching? Is it the legs, the back, the pelvic area? I mean, not, you don't have to go into it so much, but just an overview. And you said,
They could focus on the abdominal area, but I think they would be more holistic.
yeah.
Yeah.
And at least, they get to exercise different muscles of the body. So it would be a physical therapist because it's like more of the lower limbs, not an occupational therapist because it's not really the fingers, right?
Yeah.
Okay. Thank you, doctor. That's great. That's so enlightening actually, and really educational and informative. Okay, so we have that so it's true. You should exercise and it will help. Okay, doctor, I don't know if you've heard this, you probably have. There's another thing that people say, especially among us Filipinos. Oh, when you have period pain, drink a beer or two. Is that I mean, as someone who knows of the disease of endometriosis or cramps, is that does that help or not?
Well, maybe for some, but it is not backed by science.
Science.
So
Yeah.
yeah, but maybe for some it helps.
It helps. Okay. So, I was thinking because they say, oh, it makes the blood flow faster or all of that, but it
Um,
also sedates you a bit. So don't mix it with your meds, no? I mean, don't mix it with other strong medications. Okay. So, okay, doctor. So, um, can you tell us about early diagnosis for endometriosis? Why is it so important that women who have these symptoms um, should like church go already to you in particular, you're a very good doctor, or any other OBGYN to try and get it diagnosed. And you might find out it's not endometriosis, but it's something else. Why is early uh not early detection, but why is it important?
diagnosis. Well, early diagnosis of endometriosis is important for women because it allows for timely management of the symptoms, and there is preservation of fertility and prevention of long-term complication. Because delaying diagnosis can lead to increased pain, potential fertility issues, and development of chronic pelvic pain.
Yeah, okay. So it's important to go because you're the ones gonna suffer if you don't, if you don't address it, right? And
Yes.
well, it's not endometriosis, but it's something else. And Dr. De La Cruz can help you with that. Okay. And then, doctor, is there anything you'd like to say to women, especially Filipinas and in our culture, who might want to seek help and or who might suspect they have endometriosis but they're too afraid. There is this fear and also maybe shy or uncertain. What advice would you give them?
Well, if you've been experiencing painful periods, chronic pelvic pain, or a difficulty getting pregnant, and you're wondering if it might be endometriosis, please know that you're not alone and help is available. If you're feeling unsure or nervous about seeking help, please know that here in Makati Medical Center, we take endometriosis seriously. We are here to listen and to help you. You don't have to suffer in silence, and you don't have to go through this alone. We can talk about your symptoms, explore possible causes, and discuss the best plan of care for you.
Thank you, doctor. And I'm sure that reassures a lot of women who are going to watch this show. By the way, folks, we are on DTRJ 810 a.m. and we're everywhere. We're not only live, we're being played everywhere. So please watch the show again and again to learn more from Dr. De La Cruz. And thank you for saying that, doctor. It's very encouraging and supportive to a lot of women. And I can say that I feel it as a woman. Thank you so much, doctor. Is there anything else oh, I just thought of this question. You know how we have this term in our culture na mababa yung matris. Is that related to endometriosis or is that something else?
There's no such
There's no such thing as
condition.
mababa yung matris.
Yeah.
Yeah.
Yes.
Di ba?
Yes.
That na mababa yung matris. What does that mean? Like, and then they'll say, don't lift heavy things or don't go running kasi mababa yung matris mo. And it translated to English, it's like your uterus is low. I mean, like
Yeah.
pushed down, like it's too low, like as if it's anatomically incorrect in a way. So there's no such thing, doctor.
There's no such thing.
Okay. And
Yeah.
that's not endometriosis. Because a lot of people say, kasi it's the same thing. Mababa yung machismo. So, don't lift heavy stuff, don't run, don't exercise, and all of that. Okay, so thank you so much, doctor. Is there anyone you'd like to say hi to before we go, or anything else you'd like to say?
None. That's
Okay.
all. Yeah.
Doctor, if you
Yeah.
don't mind, I'm gonna ask if I can get your number after the show. But folks,
Yes.
this is I really enjoyed the show. Thank you so much, doctor. Please come back and let's talk about different topics that have to do with that have to do with, well, the reproductive system. Since you're an OBGYN, I'm sure there's so much more that we can tackle. It's been I've had a great time. I'm sure people out there will have a great time and they'll learn so much from you. Okay, so folks, we'll be back next week, Healthline with Makati Med. Until then, stay healthy. And if you have symptoms, go to Dr. 𝗛𝗏𝗁 or an OBGYN. Take care.
Thank you.
Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.